Hi, I'm Michelle. Thanks for joining me. I wanted to take a few minutes to show you some of the fascia tools that I use for self-care, self-massage. I use some of Ashley Black's tools. This is the mini blaster or face blaster. Great. These small claws are excellent for the face, hands, feet, but also to warm any areas of the body that you might treat. So this is like a pre or warm-up tool. This is the bigger version, which is called the paddle blaster. It's a little bit heavier. I use it to cover bigger areas more so than my arm, but it would be used in such a manner. And you do use oil beforehand. I've actually already done some blasting, so I am nice and warm. I was in the sauna beforehand, so I warmed the tissue up by being in the sauna. You can do exercise or shower, and you don't necessarily have to warm up, but it certainly helps to get better results. Things are opened and warmed up. So I am 6 weeks post shoulder surgery on the left today. Been using this sling quite a bit. I'm reduced time in it now, kind of like when I'm home and mellow, but I have a bunch of pillows built up under me supporting, and I'm trying to loosen up this tissue. Elbow's been pretty much 90 degrees. I had a few days where holding this ball while I was zipped in my coat put some pressure on the back of my hand and really created some gummed up feeling, some nerve impingement going right up my arm. Hurt to move my hand, and that lasted for a few days. So these tools were my go-to. And the other reason why I'm focusing on this side is your lymphatic drainage. There's no pumps throughout your body, so you move the lymph in your body based on your movement. Breathing can help to act as a pump and move your lymph, and then manually by massage. So it's important because the right arm, right side of the chest, and right portion of the head drain under the right clavicle. The entire rest of the body drains into the left. Why it's not even, I don't know. But that being said, the entire rest of my body is having a really challenging time with lymph drainage because this arm is immobilized. So I'm trying to really focus daily on helping it out and create some lymph flow. And not only that, the manual portion of working on the fascia. And the fascia is that tough skin on covering a chicken breast underneath the skin. So it's that membrane that wraps the chicken breast. Another example, maybe a more vegetarian example, would be an orange. When you peel the orange, there's still that white coating around the orange, that fibrous membrane, if you will. Same idea in our body. Covers all of our muscles, and then it even intertwines and covers the small fibers. It's from head to toe, throughout our organs, like it's throughout everything throughout our body. And so a good example would be when we have a surgery or we have an injury or the fascia is affected. If we were to twist and grab the towel, you can see it pulls from many directions in the body. Same idea. Same thing happens in the body, and I've had several surgeries recently. So using these tools just helps to keep things flowing. Normally, I wouldn't have a swimsuit top on, but in this instance, and I don't work right now directly on my shoulder. I come about 3/4 of the way up my arm, working the bicep and tricep because, again, I'm 6 weeks post surgery. I'm not doing any, and I'm not grinding in with this anyway. It's really just superficial, creating some blood flow, but I'm not working that area anyway. This is great because it covers more surface area, but this shoulder's had 2 surgeries recently, and it gets a bit tired. This paddle's a little heavier, but again, it does the job very well. And you can see that I'm getting red, and the redness is a good thing. This is bringing blood flow to the area because everything has just been sealed and locked down. So after warming up, which I have with these tools, I move on to the bigger claw. It has 2 nuggets on the end. This is a really small, pointier one. This one's a little more rounded. They're both pretty intense. So I'm going to go back to the large claws because those are enough for me. There is a lot going on in there. And normally without my swimsuit strap, I would do a line all the way up, skip the shoulder surgery part, and then right into the chest. So if I was farther along, like this arm for instance, I would go the whole way. But I don't have range of motion to do that with that arm, so my right arm's really getting left out. I have to wait for my daughter to come up and ask her to work it over for me. So I do get in there with the bigger claws. Oh, it feels so good too. Really just feels good to have my arm straight. And then into the chest. You don't really, not grinding over the collarbone or clavicle, but underneath it for sure. I'll work into the other side, right side of my chest as well. Lots of blood flow. Yeah, that feels good. So definitely forearm action has been bound up. I can feel a major spot in here. So the other thing I like to use are Chinese cups. And I learned about these when I was in massage school. A little more challenging area on the forearm, especially with what I can feel, how tight the restrictions are. May not allow me to flow, but I prefer to do dynamic cupping, which is actually moving it along the skin. My chest will be a good spot to show you. So my forearm is actually so pulled down, so locked down with the fascia, it's challenging. The underarm here, forearm will be easier to show you. And it just slides, and it stays cupped. It sucks the skin right up in. There's a little valve stem. Push that down so it keeps the air in there. And just sliding it back and forth, so a little better visual maybe. Maybe on my chest. You can see that skin sucks right up in there. And then I just slide it around. Woo! And I can feel some restrictions. And I will do the best I can to do both sides. And try to free things up. So this is a little introduction to some of the other PT tools I use, along with the power dots that I mentioned. There's different styles of these cups. So these are Chinese, traditional Chinese cupping tools. The mini fascia blaster, and mini paddle blaster, and then the larger claw with both the nuggets on the end. Those are a couple of the things I use to try and keep this body freed up as I work back from all these surgeries and make my way back to mobility. Thanks for joining me.